was sent over to me, and it sounds to me like some of the top behavioral issues are hyperactivity and lack of focus and attention, and then aggression, teeth grinding, anal itching. So what I was thinking was that under the hyperactivity and lack of focus attention, you said that, each patient is different, but a key approach is addressing diet, gluten-free, dairy-free, casein-free diet with minimal processed foods, artificial dyes. You went into a little bit about the organic testing is often used to assess neurotransmitter activity, particularly serotonin levels. If serotonin is low, precursors like 5-HTP are introduced to help improve focus. To further support calming and concentration, supplements like GABA with L-theanine for anxiety and hyperactivity, and phosphatidylserine for focus and calmness are recommended. So maybe if you want to just expand on that paragraph for hyperactivity and lack of focus and attention.
Okay. A lot of kids that present to the clinic, they have problems both for autism and ADHD. A big thing is lack of focus and concentration because these kids, they're doing ABA therapy, they're doing speech, they're doing OT, and especially ABA, they like the kids to be focused, and speech, you have to be focused. When my son was doing ABA and speech, I remember he just could not sit still. He would try to get on the table. He would try to be everywhere. So with speech, OT, focus, concentration is very important. So the first thing I do with patients working both ADHD and autism is working on diet because I find that just by changing the diet, you could definitely improve focus and concentration. So the first thing I do when I cut out gluten, dairy, soy, and dye, foods with red dye, yellow dye, all the dyes, I find that even just that will really, really improve focus and concentration. There is a study that was done that I seen PubMed about some kids with autism ADHD because of something with the digestive enzyme, they're not really able to completely break down gluten, dairy, or soy. So gluten forms gluteomorphin, casein-morphin, soy-morphin, and these are large peptides. So they're not able to break them down into very small peptides. So these large peptides, they act like opioids and bind to the opioid receptors in the brain and affect behavior. So I find that when I cut out these things, even though people will say, oh, they don't have gluten, celiac disease, they don't have gluten sensitivity. I find that when I just cut out these foods, then you'll find a big improvement in concentration and in focus. So I'll start there. I always say start at the foundation. So I'll start right there and address that first. So after I clean up the diet, gluten, dairy, soy, dyes, then I'll go into, okay, let's try to do more home cooked meals. Let's try to do more plant-based meat, oils, just not much processed stuff. And then after that, we'll go into, okay, let's go to organic to try to get everything, all the glyphosate out of the diet. And then, so I find that just by even just working on the diet like that, I'll get a big improvement in focus and concentration. And one parent even tell me that their son, after maybe about 3-4 weeks of cutting out dairy, when they did start eating like cheese again, wow, they could tell a big difference in how they feel behavior. They could see it right away. So diet for me is that's where I start with diet.
Okay, so you said those foods that have the gluten in it, the dairy in it, the casein in it, did you call them peptides that don't get broken down properly?
Right, right, into the smaller peptides.
So what happens inside the body, like when it's not getting broken down, what are those non-digested or non-broken down peptides actually doing to the body?
So those they think that they do bind to opioid receptors, just like morphine. There are receptors that they have in the brain, opioid receptors. And when those large peptides, the gluteomorphin, casein-morphin, soy-morphin, bind to the receptor, then that causes the behavior changes like hyperactivity, anger issues, just lack of focus. It causes all those symptoms. Another thing that I do though is what I'll do is I'll add digestive enzymes. So there are some digestive enzymes that you could add that will help to break these down and can improve symptoms as well. But I always say, let's just cut these foods out. If you happen to go somewhere and you have to eat something with some dairy or soy, then always take the digestive enzymes. And if you buy processed food from the store, even if it says gluten-free, it means that is very low gluten. It doesn't mean no gluten. So if you buy gluten-free products, may have some gluten, then you do the digestive enzyme. But preferably, I prefer to eat just clean foods, whole foods that you know exactly this one item, not processed food.
Okay, so when those peptides bind to the receptor, that's potentially what's causing the behavioral symptom to be like,
Exactly, exactly,
okay,
exactly,
okay,
exactly.
got it. So that's pretty much step one.
One.
Now when you mentioned the organic testing to assess neurotransmitter activity and serotonin levels, can you expand on that a little bit?
So they are serotonin neurotransmitter. 90% of serotonin is made in the gut, approximately. So serotonin is your calming neurotransmitter. So I order the organic acid test, which on that organic acid test, it's a urine test. So it will give you the breakdown products of serotonin, dopamine, and epinephrine. And although they'll say that, okay, that's the serotonin in the gut, serotonin ends up in the urine, you cannot really correlate that is the same amount of serotonin in the brain. But we don't really have a direct measure of the amount of serotonin in the brain. That's about the best measure that we have. So we'll do that urine, and then it's not a 24-hour urine, it's just a snapshot. So there is no test that I know of that can give you a really true picture of, okay, this is the amount of serotonin that you have in the brain. But I will use this urine test, and if someone is hyper, then I'll add like the precursor to serotonin, which is 5-HTP, and I'll give that 5-HTP. And based on my experience, when I add that 5-HTP as a supplement, a lot of kids, especially with ADHD, and a lot of kids with autism, because some kids with autism does have dual diagnosis, and a lot of kids with autism, they're very hyper. So when I add 5-HTP, I notice that the physical therapist, the speech therapist, the occupational therapist, mom will say that, okay, before they were only able to sit for 3 minutes to do their work. Now they're able to sit for 5 minutes, they're able to sit for 10 minutes, they're able to focus more. And serotonin is a precursor to melatonin. So sometimes when you add serotonin, 5-HTP, then they're now able to sleep better. So that's multifactorial when adding the 5-HTP. So sometimes if the serotonin is low in the urine, I'll add 5-HTP, and a lot of times you'll see some improvement.
Okay, so when you do the organic acid test, typically on a blood test comes back, there's like a range of like, low, high, optimal. Are you looking at that range to then help know like where their level is at, and then that kind of gives you a trigger as to like what you could prescribe in the way of the natural supplements?
Yeah, they have other tests that will give a blood and urine, but that organic acid test is pretty much urine. So it's looking at metabolites. So on that report, it is a range. It will give you a range, a normal range or the average, and then it will give you way down at the other bottom of the that bar where it's kind of low, and then it will give you whether it's high. So they do have numbers with ranges there. So you could kind of look at that and determine if it's within range or not.
Okay, so that's a pretty big part of the equation on the program is when you do the tests, that gives you a little bit more targeted analysis of where they're at, and then you can use that to help fine tune their program.
Right. That test is very helpful. It shows not just the neurotransmitter levels, but it also look for metabolites for Clostridia, Candida, mold. So it will kind of guide you into treating for microbes or doing further testing in that area.
Okay, perfect, perfect. You also mentioned to further support calming and concentration, supplements like GABA, L-theanine for anxiety and hyperactivity, and phosphatidylserine for focus and calmness. What can you expand a little bit on why you like those supplements?
Yeah, so with functional medicine, holistic medicine, I find that it's not just one. There's so many, if you check PubMed, there's so many different studies looking at so many different supplements that can be helpful with ADHD, with autism, with hyperactivity. So once I'll go to 5-HTP if they're having a lot of problems in school, focusing, staying in their seat. And then after that, the phosphatidylserine is also another one of the supplements that's been studied in ADHD. So I'll do the 5-HTP, and if that's not enough, they need a little more, then I'll add phosphatidylserine, and if that's not enough, sometimes you could add even saffron. All these, they have small studies in PubMed that have been helpful. And of course, GABA is a common neurotransmitter as well. So GABA, when you combine that with L-theanine and they have supplements, GABA plus L-theanine in it, you can add that as well. So some kids you could add, they respond well to saffron. Other kids will respond better to 5-HTP. Other kids will respond better to phosphatidylserine. Some people need a combination. But I magnesium with vitamin B6. There are so many different things that one can try to help with calming in autism and ADHD um, before you go to medications. And that's what I do. I've been able to help a lot of kids just by doing the diet and then adding supplements, and that have been enough to so that they could do really well in school without medications.
Okay. Okay. You also mentioned some other symptoms: aggression, teeth grinding, and anal itching, which could be correlated with an underlying uh, parasite infection, um, which leads you to possibly using a stool study to check for parasites. Um, can you kind of expand on that a little bit?
Yes. So parasites I find, and this is pretty much a lot that I've seen just based on my experience with my son and with just treating kids with autism. I treat most everyone's at some point in time. I'll give some parasite treatment or do a parasite treatment protocol. I find that a lot of kids, when they come and they have a lot of aggression, and I look at their blood work sometimes, and their lymphocytes and eosinophils are elevated, and sometimes they'll have a lot of digestive issues, and some will their parents will say, okay, they're grinding their teeth. And I find that when I just whether I find, because some people don't have the money to get the stool studies, sometimes I'll order it for their regular lab. But I find that if I just do a protocol, a parasite protocol, parents will say now they're sleeping better, they're no longer grinding their teeth, their behavior is better. So always in my practice, I will always do just a parasite protocol for most kids with autism, at least once.
Okay, perfect, perfect. Um,
And
besides
one
the
other
aggression,
thing,
oh, uh-huh.
go ahead.
No, say what you were gonna say.
Yeah, so what I noticed, because one reading about parasites and listening to some other doctors talk at conferences about parasites, they talk about the lunar cycles, and during the full moon time, how there's a increased activity for parasites. And sometimes the parents will come and I'll ask them, do you notice there's the aggression, the change in behavior? Is that more prominent? Do you see it more during the full moon time? And they'll start taking notice, and they say yes, around the full moon time they seem like there's a change in behavior. So what we'll do is we'll concentrate the parasite treatment right around the full moon time, before the full moon, the day of the full moon, the day after the full moon. And a lot of times, if you do that, maybe 2 or 3 or 4 cycles of doing that, then you will get rid of the parasites.
Okay.
I
Okay.
thought that, I thought that, okay, that was just me or a lot of other doctors, but I was just at a conference, and I heard another neurologist said that he noticed that during the full moon time, around nighttime is when he gets a lot of calls. So there is something
Interesting.
definitely between that lunar cycle and parasites and behaviors.
Okay. Besides those behaviors, I know I get a lot of parents that mention like stemming, um, like a limited diet, and a lot of like very repetitive habits. When you see that, um, are there different like tests that you look into for those behaviors, or do those kind of fall in the same bucket with these other ones that we've talked about so far?
Yeah, I find that there is an article that it's the autism research diet, and that autism research diet, they looked at, I think they interviewed 818 parents of children with autism, and kind of talked to them about what was the best diet for what symptom. And it seemed to me, based on looking at that research, that a lot of the symptoms seem to respond very well to a ketogenic diet. So I find that even for stemming, for hyperactivity, just cutting out a lot of the sugars, especially all the processed food, cutting out a lot of the sugars and going more towards protein, meats, fats, the brain seem to do a lot better on that food, those kinds of food. So cutting out a lot of the processed food, high carbs, high sugar, a lot of times that will reduce the stemming. I always go back to when I was going through it, because a lot of the things and a lot of the patients that I see over time, I find that I don't focus as much on the behavior. They do a lot of stemming, but I don't really stop them from doing it. A lot of parents will say stop doing that, but I don't, because I realize that whenever I fix the underlying issue, whatever is causing them to stem, whether they're doing this with the hand, with the eyes, or whatever they're doing, whenever you fix the underlying issue, then the behavior will stop. So I focus, and it seemed to be different, I noticed, for every single person. So I'll focus on, I know for some kids, even just starting a very multivitamin, multivitamin that's specific more for autism ADHD, even just starting that when you're replacing minerals, trace minerals, vitamins, then a lot of times you'll find that the stemming will go down. And changing the diet, going to more of a ketogenic, closer to a ketogenic diet, you'll find in a lot more of the symptoms will go down. But what I like is just doing a lot of testing. I'll do a lot of blood work. I'll do the stool studies, urine study, and then just hair analysis, and then I'll work on all those things. And I find that once I start working on all those things, then the stemming and the sensory issues, all those things, once you start replenish those things, a lot of times they will get better. One thing I say to parents, this is a marathon and not a sprint, because a lot of parents, they just want it to go away like yesterday. But it's just the consistency, day after day after day. and just doing what you need to do. And after that, with time, the symptoms normally resolve for most people, that is.
Okay. So most of the behaviors kind of all diminish simultaneously over time by following the things that we've already talked about before. It's not necessarily always, well, this behavior correlates with, this food or this supplement. It's like a comprehensive diminish of everything because of the program.
Right, right. And I always say everybody's genetics is different. So they say if you see one autistic person, you've seen one autistic person. Because I'll try one thing for this person and it doesn't work, and I'll try the same thing for the next person. You'll get awesome results. So it's just by taking it one step at a time, doing individual testing, and then doing the treatment based on that person's results.
Okay. One of the frustrations I hear a lot from parents is when they do try to change behavior in the way of getting kids to eat a cleaner diet or getting the supplements into the kids consistently, they struggle with the negotiation with the kid to get them to comply. Do you have any insight on what parents can do to help negotiate that with their kids over the period of the program?
Yeah, and that's going to depend on the parenting skills because it's hard for me to say because I've been a doctor all my life, 20 years or so I've been a doctor and I've been a hospitalist. So when people come into the hospital, they need medicine that I never thought, okay, are you going to take it or are you not going to take it? Because a lot of time these are life-threatening illnesses and you have to take it because of what are the options. So I look at autism when I had my son and I looked at him. I look at it just that way. There's no negotiation. This has to be done. So that's my perspective. That's how I did it. I mean, you just have to take it. It's a medicine. And I think that if some parents can look at it, some parents just can't because they don't want to push their kids, they want to negotiate. But if I look at it, if your child had a really bad pneumonia, or your child had type 1 diabetes, they don't get this. They have to get shots with the type 1 diabetes. They don't get this. They're going to end up in the ICU. They're not going to survive. So the shots are painful, but you're gonna make sure it happens because there's no option. So for me, when I was going through it, I said, in my mind, that's how I look at it. There is no option. So this has to be done. So I know they have feeding therapy for people that are really challenged with kids taking food, taking supplements, and they can work with you slowly, play around with it. A lot of patients tell me they learn how to touch it to the face, touch it to the cheek, and then kind of get adjusted to it. Maybe put a little piece in your mouth, and they slowly can. So for every person and every parent, personality is different. They could work, slowly along that way, that line. So it depends on other things you could with my son, I really tried hard. So if he really did like something, I find a way. I change it around. I find a way to I'm gonna tell you this one that I did. I this I can't.
Mhm.
So I always made these big pots of broth, my meat stock and my bone broth, and I would give him, the goal was for him to have a cup with each meal. So he really did not like that bone broth. So what I did was because of what will taste good to me probably will not taste good to him. So I tried everything. So eventually for breakfast, I would have his cup and I would add the bone broth and then I'd add some of those chocolate syrup in there, a little chocolate syrup. And then he liked it. So it wasn't the same taste all the time. So then I realized, okay, so it tastes bad to me, but I just kind of each meal, so it won't be the same thing and you get tired of it out. I'll try to add little things to it so that way, and just test him with it. And if he doesn't like that, I find something else. And I find that it's really, you just have to keep working it until you find something, but giving up is not an option. It's just finding what works with that child.
So the advice would be you really need to have a lot of patience, be willing to stick with it, and then each day you just have to really focus on being creative and changing
Right.
things up until you find that right formula to get it going in the right direction.
Exactly.
Okay. Okay. And for for parents that have a difficult case and they're really leaning more towards the pharmaceutical route, what would be some insight on explaining why doing it this way versus the pharmaceutical drug route? What would be the case for doing it the biomedical route?
I know just from my experience, a lot of, and there is research has shown that kids with ADHD start on medications. By the time they get into their teens, they'll get a second diagnosis like anxiety. So, and they start one medication and then they'll end up with two, and then they get an additional diagnosis and they end up with three. I believe that, and not just me believing, the studies show that you have to treat the underlying cause because we did not have this epidemic of ADHD, anxiety, all these psych disorders, autism. We did not have this back in the 60s and the 50s. It was not this prevalent. So I believe that there are some underlying issues in the body that's causing the child to be anxious, lack of focus and attention. So I believe that just testing, just like any other medical problem, you go ahead and you test and you try to treat the underlying cause, changing the diet, then you get it takes a longer time. But when you do, you're treating the underlying cause. You're not just treating the symptom. Okay, you see hyperactivity, I give you a stimulant, and then you're calm and you can sit for studies. That you're just covering up or just taking care of the symptom, but not the underlying issue. So I think long term, um, if you just treat the underlying problem, then you will not need medication in the long term.
Okay, perfect, perfect. So recently, do you have any patients or clients that you're working with that you've had like a really good success story lately?
I have I've had several, and because initially when my son had autism, I say that a lot, my son had autism. I would go to conferences and people would say they say thousands of people have recovered from autism, and then I'd wonder, oh, will this happen to me? And then after 2 years my son got better, and then I wonder, will it, is it just my son? I wanted to see other kids that have gotten a lot of improvement. And then just by me doing this, as over they putting people on the program where I see them every other week or every week for a year. And I have I nice to say that I have patients now that they have gone from regular classrooms from autism class and barely verbal and all that to speaking fluently, transition to regular classroom, doing well. After 1 to 2 years of just guiding them through the same thing that I did with my son. And I have someone else that's going to do a testimonial with you because they're just so excited. So I really believe it has a lot. I believe that it's not a lifelong diagnosis. You can get improvement until you cannot see any symptoms. I really believe that a lot of the problem is in the gut. And if you really, really focus on changing the diet and detoxing the body, replacing minerals that are depleted, and doing all those things, you can recover or you can get significant. I've not had anyone that I can think of through my mind, maybe one person that have said or have gone through and done a lot of biomedical and not seen any results. Most everyone can tell you that they have seen some results or a lot of results from doing biomedical. Sometimes it depends on how early they started, but if you started anywhere from maybe 2, 3, 4, 5 years old, then a lot of times there's a good possibility that you'll lose pretty much almost or even if not all the symptoms of autism,
Okay,
ADHD.
okay, perfect, perfect, awesome. Well, I think we covered quite a bit today. We got some good content. Anything else you want to add or anything on your mind?
No, no.
Okay,
I just have to,
okay,
I'll prepare for some more. Oh yeah. So and this could, because I know people are searching for people come to me because a lot of people are talking about B12 and folate antibodies or folate receptor problems. So I have several patients that have Dr. Newbrander is a founder. He's the one that started subcutaneous B12. So I have my son did the B12 shots for 18 months, and I've had now several patients that have done the subcutaneous B12 shots, and then I did the FRAT or the folate receptor antibody testing and find that they had antibodies, either blocking or binding antibodies to the folate receptor. And then when I add leucovorin, which is high dose folinic acid, they get a significant improvement. They start talking more, some start talking in full sentences, and they respond appropriately to questions. So I know a lot of patients have questions or concerns about whether they should do the FRAC test or whether they should do leucovorin. But I have had not every child. Some children I added and they just get hyper. But a lot of kids, once you do the B12, get some results because that helps with methylation pathways, sulfation pathways of detoxification. All these things are involved. So once you add the B12 and methyl B12, that is, and then you had a folinic acid or 5-methyl tetrahydrofolate, a lot of kids, you'll see a lot of improvement in speed, focus, making longer sentences, concentration, responding more appropriately. So you'll get a lot of improvement. Some people will get a lot of improvement with that as well. But what I normally do is focus on the foundation diet and fixing, the stool and all those other tests and fixing all those foundational areas. And then after that, I'll start with the B12 or folate, unless there's a child maybe 3 years old and their main issue is speech. Then sometimes I'll go do the blood work, make sure I look at B12 levels, and I'll go straight to B12 and folic acid.
So is the B12, is that an injectable, an oral supplement? Like what do you like best with that?
The Dr. Brander, when he did the study, based on reviewing his literature, he compared B12, methyl B12, subcutaneous, oral, sublingual, and he found that the best one, he got the most results or the best results from the subcutaneous B12. So
Mm.
I do the subcutaneous B12. He found in his research that once you do it, commit to it for about 18 to 24 months.
Okay, and is that a once a week injection, multiple week injection?
Yeah,
How does that work?
I start off with once, maybe twice a week, every 3 days. And
Okay.
then after a few weeks, see how they're responding, if they're getting an improvement, and then I'll go to every other day. And then some people I'll even go to every day. It's just kind of watching and see, okay, is it wearing off? Can you tell when after a day or two or what's going on? And then you kind of adjust based on that.
Okay, and then did they come in to your office to get that done, or do you
I
do you
know I
like
teach them how to
teach
do it, and the
you
pharmacy delivers it straight to their
oh,
home.
okay, so you teach them how to do the injections, pharmacy delivers it, and then you figure out what the dosing schedule is, and they just kind of play with that.
Right. So they already have this, they have pre-filled syringes. So the
Okay.
pharmacy sends them a bunch of pre-filled syringes. So they just take it out and they just give the shot and they just throw it away. They send
Okay.
them a canister to disposal thing to put it in.
Interesting. Interesting.
Yeah.
Okay, so that's something kind of that you've been working on and been seeing some pretty good results with.
Yeah, and I did it for my son too, and I got, because he was nonverbal, and I got pretty good results, and I've seen quite a few patients with good results with that too.
Awesome.